Hi, everybody. It's Dr. Ruff. This week, I'm going to try something new. I am going to try to just give you a little verbal description of what we're doing this week, the topics that we're going to cover, and also a little review of the articles that you're going to read. And then at the end, I would love to know if you guys like this, you found it helpful. So let's go. Okay, so this week we're going to talk about receptive and expressive language disorders. We're going to talk about the features and causes and assessment and intervention strategies for language disorders. We're also, I don't believe you guys have a chapter this week. It's the 3 required articles, your receptive language disorders article, teaching receptive vocabulary to minimally verbal preschoolers with autism, and the effects of augmentative and alternative communication interventions on the receptive language skills and expressive skills of students with developmental disabilities. So, what are language disorders? Language disorders affect a child's ability to understand receptive or use expressive spoken language appropriately. So again, I know we had a lot of questions on the assignment last week about the difference between language delay. So there's DLD, which is developmental language disorder, which is an actual disorder that has been diagnosed. It will continue throughout the lifetime, as opposed to the more general term specific language impairment, which we used to use, and developmental language delay, which is kind of something that we give those kids at an early age, implying maybe it's kind of just their developmental growth is a little slow. We might see them catch up. But once they get that kind of disorder status, that will stick with them. Now that just means they might have continued challenges, but it doesn't mean we can't teach them, or we can't teach them coping mechanisms or supports. But it is just their brain profile. Okay, so for receptive language disorder, that might look like trouble following directions, difficulty understanding questions, poor comprehension of stories. Often responses may seem like inappropriate or off topic. So for example, these are little ones. It's good to know this because sometimes you might think, oh, they're just being silly or they're not paying attention. But when in reality, they might actually just be trying to generate a response. And being a 5-year-old, they might give you a silly response. But really, what happened was they have no idea what you just said to them. And they're just trying to give you a response. So I have a little kid that I actually worked with in speech therapy. She was so cute. But this is it's like, preschool humor. But I would ask her a question and she's like, that's a butt or something. And it was just what she found like entertaining because she had no idea what I had just said to her. And then the little kids would laugh and it worked for her socially, but really it was a symptom of a receptive language disorder. Okay. So expressive language disorders, this is where you're going to see your limited vocabulary, short or incomplete sentences, difficulty finding the right word, maybe incorrect grammar or sentence structure, and frustration when trying to communicate. So you might also see students use behavior as communication. This is might be more of when they have that expressive language deficit. People and humans in living organisms will always use the most efficient means of getting their needs met. So if they're struggling to compose and make requests, compose messages and make requests, they're going to use the easiest thing. And if for them that's behavior, they will use behavior. So that's why we might see some of our language kids actually have a lot of challenging behaviors because they can't find the word or the request. But every time they yell, they get juice. So they're going to yell instead of trying to use their words because that is the most efficient way to get their needs met. So that's something to keep in mind when we're not only coaching on language, but we're teaching teachers or parents what to do. We want to kind of not really give into that behavior, and we want to really encourage them to kind of force them to use their words and then immediately reinforce the word use so that they are getting that repeated practice and they're learning, I get my needs met with words as opposed to this really easy but inappropriate behavior tactic. And then there's mixed receptive and expressive language disorders. This is a combination of the two. But then there's different groups that might have a different profile, like with autism, especially maybe like level 1 autism, they might have really elite or kind of little professor level language production, but maybe their receptive language scores are lower. So a lot of times when we're doing autism assessment, we'll not only test their social behavior kind of profile, social communication behavior, but then we'll do that language assessment. And then if we see that maybe they have a higher expressive score but a lower receptive score, that's another indicator of autism. So who has these language disorders? Anybody with maybe developmental delays, autism, neurological conditions, if they had a TBI or a brain injury, hearing impairment, especially if undiagnosed early. They haven't learned those kind of supports to be able to use their like visual cues to help them interpret communication. So they're missing a lot of the message and they're missing a lot of that expressive production as well. Genetic or hereditary factors. And then, anytime that there's like a birth trauma or premature birth or low weight, that kind of puts the child at risk as well. So we are the ones that get to diagnose for language disorders, receptive and expressive. We do it through assessment and observation. And also, as with anything development, child related, early identification and intervention is always best. So we want to keep an eye out, kind of look for those cues. Always be talking to the team. Always be, maybe if you're on the early intervention support team or the IEP teams or anything like that. I think we were called IST in our county. You want to be listening for those, oh, they just never listen, or oh, they can't learn, like academic behavioral concerns, because a lot of times there can actually be an underlying language component that has not been identified yet. Okay, so assessment strategies. I think everybody did a really good job on grasping that kind of comprehensive assessment idea. We do not want to just rely on standardized tests, as I think a lot of you guys really were able to capture. Because while it does give us valid results, this is, kind of like norm referenced results, it a lot of times will not capture the whole child. So we want to always do like a case history, interviews of key stakeholders like teachers, parents. If the child sees a tutor, talk to the tutor, extracurriculars, anything that the parents will give you permission for. It's great information, but I would say at the very least, you want that teacher and parent interview, because students also often look different at home versus at school, or maybe they look different in the classroom versus in specials. So we kind of want that like holistic view. And then, of course, but standardized language tests are great, and they're also basically almost always required for any sort of educational IEP supports or insurance-based reports. And a lot of times they want you to do at least two. So there's the SELF, which is a very comprehensive language test. They'll break down every single component of language, like the idioms, the figures of speech, receptive, expressive vocabulary, conversational, like they really kind of do that deep dive. So it's amazing if that's really like our primary thing we're looking at. If you're kind of doing more of like you're looking at the whole child, maybe we have some like articulation concerns, some social behavior concerns, some language. I really like the OWLs because it gives you kind of those good standardized language scores to kind of let you know where you're at, but it's really concise. Like you can kind of, normally complete it in like 30 or 40 minutes. So it's good if you're assessing other things. Then PLS5, which is toy-based, that's for little preschoolers. That one's really fun. And the test of language development. There's tons of them out there, but these are kind of like the ones you might run across. We always want to do a language sample. Again, comprehensive assessment. Like this, we want to be talking about their topic of interest, or ask them what they did this weekend, or what their favorite toy is and why. Anytime we can get them talking about something they're interested about, they're going to give you more. They're going to give you more expression, and that's going to be a lot more to kind of work with. You can do play with them with nursery rhymes and see if they can rhyme. fill in the blank, ask them a question and see if they can finish your sentence. But if you do this just even for 5 or 10 minutes, you're going to get a pretty good idea of where they're at. And then naturalistic setting observations, these are huge as well. And again, you don't need to kill yourself. I think some people might require like a full 30 minutes, but a lot of times you can get away with like a good 10 or 15 minute, observation period, depending on what your district requires or what the clinic requires. But definitely, seeing how they interact in the classroom or on the playground. How are they doing at lunch? How are they doing at specials? And then if you're lucky and you have the time, I know a lot of times we're limited for time, but it's really good to compare and contrast. So maybe do like a 10-minute observation in the classroom and a 10-minute observation on the playground and see how they change. Like, are they very silent with their peers? Are they socially engaged, which means they kind of have that social brain, but they're very silent. That it could just mean that they're shy, but it could also mean that they want to play, but they really struggle with that kind of language component. Do they let other people talk for them? Like that kind of thing. So, intervention strategies. So for receptive language, anytime there's sort of a language thing, of course, with developmental disabilities or intellectual disability, autism, yes, we need to use visuals, but also for our language kids, because they have a brain difference. If it is a true language disorder and even a delay, they are struggling with that part of their brain. So anytime we can kind of support and scaffold them with the use of visuals, pictures, they're going to be able to be getting that auditory and visual, watching our mouth input, but they'll be a little supported with the pictures, so they'll be able to grasp it. And that's going to help us to get kind of those repeated trials and practice. We want to simplify and repeat instructions. So that is key, not only for us, but for teacher and parent coaching. And anytime I train a parent or a teacher, I like to give them a reason like why it will benefit them as well. Because, even though they definitely, care about the student and want the best for the student, they're very busy. They might have other children or they might have a class of 30. So you kind of want to give them a reason why they will benefit from it so that they're more likely to do it. So like if you kind of model for the teacher, give them short sentences, 4 to 5 words, like, bring me your paper. Pause. Bring me your paper. What did I just say? Checking for comprehension, not being mean or, but just giving them a chance. Making sure they're paying attention to you when you're talking to them. Have them repeat the instructions back. And so the buy-in is not only does their brain need that, but if they can hear the message, then they're more likely to comply with your request, and you're not going to have to ask them 15 times to do something. Interactive book reading. This one is huge. I basically almost always use this for any sort of language development because it's so versatile. First, you always want a picture book, because there's that kind of scaffolded visual support, but then you can use the book any way, shape, or form. You can, like if you're working on pronouns, you can look at every single page and just focus on the he, she component or something like that. Like, what is he holding? What is on her shirt? And every page just going back, page, and just practice, repeat it, always that repeated trial. But for the very same book, you might be working on, like a little bit more of like story comprehension. So you might read a sentence. You don't want to read the whole paragraph because they have a language disorder. So you want to meet them where they're at. Like you don't want it to be too difficult, but you also don't want it to be too easy. You need them to be right in that. It's just hard enough that they're learning, but easy enough that they can access it and have the possibility of achieving success. And that's actually called your zone or proximal development. But so you ask one question, read one sentence or maybe 2 sentences, depending on where they are, and stop and be like, what did they just do? But luckily, hopefully, like for example, if the sentence was, the boy and the girl went outside and decided to play a game of cards. But there's a picture of them playing cards. And now you're asking the verbal question, what did they just do? So they can think about, recall from the story, but they also have that picture for supported comprehension. So that's just another way. You can use the same book for a million different reasons. I love books in therapy. Expressive language strategies. This is a really good one is modeling and expansion. So again, you'll use this with our like younger kids or our autism kids or developmentally delayed, where they have these like really short sentences or maybe no sentences at all, and you're kind of narrating what they're doing. But same with our language kids. So like if they have an expressive language disorder and they say, she go out, you can say, that's right. She went out. She went out. What did she do outside? And then kind of model, but then expand to kind of like keep the conversation going. She went out. She went out. She went out and got a ball. She got the ball. And then have them, what did she do? And then like always kind of make it playful, but kind of giving that opportunity to hear multiple examples, multiple expanded examples, and then maybe even giving them the chance to restate what you just said. And sometimes if they're really struggling or if they're younger or they're autism, you can even just ask them to copy you. Like the child will say, she go out. You say, oh, she went out. That's right. She went out. Can you say she went out? And these things seem so simple, but you're slowly correcting them and you're giving them tons and tons of examples and giving them a chance to fix what they said while still kind of making it engaging and social and play-based. So we're just giving them that just constant opportunity to reattempt or to fix or expand language. And then if there's storytelling, narratives, rhyming, you can also use augmentative and alternative communication, which we'll talk about a little bit later when we go kind of just touch on our articles. And then parent-teacher training. So anything we do, we want to train the parent and the teacher because they not only does a child need to be able to meet these goals and show that they have these skills in the therapy room, but they need to be able to use them in the real world setting. So when we train our teachers and our parents, now you're getting that carryover into the other settings. And this is something that that's called generalization other settings. So this is something that we basically almost all therapists, whether you're OT, PT, speech pathologist, behavior, across the board, time and time again, this is the thing that sometimes we don't get to or we forget to address, or maybe our case loads are like, cool, bye, see you next week. But even in the research, it always says, need more research on generalizations to maintenance practices. But we can really easily address this by training the teacher, training the parent, and following up with the teacher and the parent to make sure that they're actually doing it and explaining the importance of having them work on these skills in another setting and using it in a real life setting. And then anytime you give like a gen ed teacher or a parent kind of a new skill, like we need to just remember, like, meet them where they are, but they are not special ed teachers. They are not speech pathologists. So we don't want to overwhelm them either. So we want to give them one or two simple strategies of what they can do to help the child in their setting, and give them a really specific example. Like, anytime you give them an instruction, have them repeat it back to you. Or when you talk to them, make sure when you give them an instruction, always give them a 4-word sentence. Or like if you're talking to parents, just say, like, I don't want you to kill yourself. I know you're busy and, you guys want to keep your parent-child relationship. Just pick 15 minutes every day to sit down with a storybook and have them name the pictures or have them talk about the colors of the picture. Like, give them just like a little target that's easy to understand, easy to use, and feels really accessible so they actually do it. So goals for intervention, of course, we want to improve functional communication first. That is not academic or social. It can be academic or social, but it can kind of have that dual meaning. But really, it is that we need to give them survival skills because we want them to be using words, not behavior, or not getting their needs met. So first, we want to make sure, can they ask for a glass of water? Can they listen to one-step instructions? And those are kind of the things that we just really want to, those are the functional skills that we need. Can they read a sign? Can they, just like kind of basic things like do they understand that the pictures match the words in the book? And then from there, we increase vocabulary, grammar, sentence structure, work on those comprehension skills for academics, and social language, because a lot of times, anytime we have a language deficit, we have a lot of that kind of like withdrawal, social isolation. We can't really express our true selves to our friends. It's hard for us to kind of connect. So we really want to build up those social language skills, give them some strategies in their toolbox that they can use while they're learning, their language skills. Like maybe we can teach them what to say to initiate with a peer, or to ask if they want to go on the swings or go on the playground, or do they want to share, or do they want to color, that kind of thing, so that they can be making friends even while they're on this kind of journey of improving their language. And then, of course, generalization across environments, which we talked about. Okay, so this week I'm not going to touch much on it. We talked a lot about it. I don't think you have a chapter. Yay, you got some time back. But you do have a couple of articles to read. So it is receptive language disorders. Again, we talked about that, so I'm not going to really go over it. Then the next one is teaching receptive vocabulary to minimally verbal preschoolers with autism spectrum disorder. And then after that is the augmentative and communication interventions for receptive and expressive language for developmental disabilities. So for the autism one, let's go down. Sorry, I have my little cheat sheet to help me not forget. So this is gonna give us kind of some strategies of how to work with our minimally or nonverbal preschoolers with autism. And they talk about some strategies like DTT, discrete trial training. This is going to be that, you'll see this a lot in like ABA, but it's really that one-on-one instruction, which is it needs to happen. It's your required element. So this is where you're going to get multiple trials. You're targeting, I'm just going to keep using the pronoun example, like, is this a he or she, going, like having a pictures and having them like pick, or is this him or her? And then you just do like 50 cards of it. And just letting them practice, telling them why they're wrong, that kind of good stuff. But then you never want to just do that. You want to also do those naturalistic teaching approaches, which is following the child's lead, like maybe now we're playing with dolls and we're saying, oh no, he dropped his ball. How does he feel? And then like kind of just really like accentuate what we're working on, but have it be like child-led, fun, interactive, and that will kind of work on that almost like in therapy generalization skills. Because if all they can do is name a card, that's not really functional. And then we always want to use visual supports. Like again, this can be, this for developmental disabilities, but even with our language kids, anytime we're going to support language comprehension or production with a picture or a symbol, we're really supporting that kind of brain challenge, and to kind of just set them up for success so that they can actually practice producing the right response, or they can practice like hearing the message with the help of a visual. And the more we kind of practice that skill, the more it'll start kind of like taking hold. And then of course, alternative augmentative communication is another intervention we can use, which we'll talk about next. Then there is, so therapy, we always want to be consistent and have tons of repetition, because not only are we teaching the skill, but we're giving them time to practice, right? Another thing, this one is actually a behavioral principle, but immediate reinforcement. So according to behavior sciences, the more immediate the reinforcement is, the better. In fact, they even go so far as to say is if you've waited a minute to reinforce, you might as well not have even reinforced, because so much has happened in that time. Who even knows what you're reinforcing at that point, right? So the more immediate, the better. So if we're wanting a kid to have a verbal production, they're normally very quiet. And then all of a sudden they say, roll, roll. That's right. The car rolled, roll, roll, roll. And you want that immediate reinforcement so they know they did something correct. And then a lot of times, even across the board, even in autism, which a lot of times there's this misnomer that they're not social. They actually are, they're just differently social. Social praise and reinforcement goes a long way with most children. And then we always want to work on that generalization. And last but not least, the augmentative and alternative communication. So this again is great for any sort of developmental disability, but can work with our language kids as well, supporting them. It helps to improve attention and engagement. You're using symbol reinforced learning. You're increasing input through modeling. So when the teacher is modeling how to use the device, you're kind of reinforcing the use of the device, showing the child how to use it. They're seeing and learning at the same time, and now they know what to do. And contextual learning, we want them to be using these AAC devices in real life situations. So the biggest thing that I see with this is you'll work on the AAC device in the therapy classroom and then take them back to the gen ed classroom and they put the device in their backpack. That's not going to help anybody, because if a kid needs an AAC device, that is their voice. You wouldn't ask a typical kid to put their voice in the backpack for this last 6.5 hours of the school day. And not only that, they need to have access, even if it's distracting, right? Because the teachers will say, oh, well, they're just playing with it, it's distracting. But it's their voice. It's like, again, you wouldn't ask, just because a typical kid is maybe off topic or speaking out, you wouldn't ask him to put his voice in his backpack. So we want to really help to explain that concept. This is not a toy, this is their voice. But also we want to highly encourage the teacher to use the device when they're talking to the child and throughout the school day. Maybe it's not realistic for them to do it every single time they talk to them, which is the goal. But certainly, frequently checking themselves. When was the last time I spoke to the child on their device, so I can model how that they use it? So there's two different ways that we can do this. There's high tech and low tech. Like there's like the iPads that you can use, but there's also, which is high tech. There's like sign, even like drawing, writing. That's kind of more of the low tech side. But either way, regardless of what we're using, if we're asking a child to use it, the adult should be modeling it, because we're the child's teachers. So how is a child supposed to know how to use language through this if we're not modeling what it looks like? Then there's also the core vocabulary boards. I love these because they're so easy to use. They're free. They're a great thing to do when you are maybe waiting on a device from like insurance or from like the school district. And they're also not intimidating. So like teachers might be more willing to use it. Also, if you create a core board, which is basically just like a little paper with like pictures on it, you can duplicate it. So you can give it to like mom, dad, grandma, teacher, art, music, principal, all those kind of things. And that way you're using the child's voice in every setting. Or maybe they have a voice, but they needed that supported comprehension, and you're using it in every setting. So they're really just getting like the language practice, the vocabulary exposure, tying like a concept to a word multiple times a day. You can create them for free. You can create a Word doc. You can go on to teacherspayteachers.com, pay $1 for an already generated Word doc. There's a website called Lesson Picks that is so cheap. I can't remember how much it is, but I want to say like $7, and you can like create them from scratch. I mean, maybe $30, but if it's $30, it's like $30 for the year. It's like very, very inexpensive. But I think that's basically it. So that's a lot of information. Again, this is a lot of the stuff that you're going to read in your text. You're going to read in, typically you're going to read in your textbooks. You're going to read in your articles. You're kind of taking away this from the assignments. But please let me know if this was helpful. I know this was 30 minutes, so it's 30 minutes every time. But if you do find that it's helpful, I will continue to do them. So definitely make sure to give me feedback. And I bought this little thing from a thrift store. It says, "You got this," and you guys got this. So you guys are doing great. Keep it up. All right, bye.